We're going to call this work session to order, and we have joining with us via Zoom Board Member Max Queen, Buncombe County Health and Human Services Director Stacy Saunders, and our school health nurse April Bauer. So the meeting's called to order. Stacy, are you with us?
Yes, ma'am.
Okay, good. Right now?
It's the next thing on the...
Okay. We were trying to get it with Stacy because we could, we'll do that after we do this health thing, please. Okay. Who's in charge?
Right.
Madam Chair, you want me to?
Yes, Dr. Baldwin.
Madam Chair and Board, I just want to take just a couple of minutes to extend our appreciation to Ms. Saunders for being with us once again. I think since she became the new Director of Health and Human Services for Buncombe County, she has prioritized being with us. She's been in front of you giving updates on the local COVID metrics for prior to every board meeting. So again, I know her time is extremely, her calendar is extremely busy, but we appreciate having her. And so with that, we're going to turn it over to Stacy Saunders.
Thanks so much. I'm going to share my screen with you all. Give me just a second. Great. Are you all seeing that?
Yes.
Great. All right. Perfect. So well, first let me say thank you for inviting me to attend your meeting. And just point of clarity, I am your public health director, and Stony Blevins is your health and human services director. So I just want to give credit where credit is due. And then with that, I'll just go into what I typically do for the Board of Education and school systems is talk about the COVID-19 situational report and where we are, and then just a little, some brief updates about vaccine. And let's see. Is that changing for you all?
No.
Okay. I'm going to try something else real quick.
And I'm just wondering which one it is we're following. Okay. Okay. Thank you.
There we go. Is that looking right to everyone now? Okay, great. So I always start off with talking about where we are with new incidents and cumulative cases. And so since we're meeting now at around noon, the North Carolina DHHS dashboard has not updated for today. So all the things that you're going to hear me say are from earlier, from yesterday. And so just as of yesterday, we had a total of 15,227 total cases of COVID-19 in Buncombe County that have been identified, with 288 COVID-related deaths. And this is about a new case per day on average, about 66 new cases per day on average coming into our public health workflow. And then as far as the cases per 100,000 per week, that's looking to be from earlier in the week when we pull the metrics table, about 171 new cases per 100,000 per week, which is down significantly from the beginning of the year. And it's about a 57% decrease since that time. And so this is just the state distribution of that cases per 100,000 per week. And you can see here, we're over there in the 50 to 200 range, much lighter blue than what we were seeing in some weeks before. So that is a considerable decline from what we were seeing throughout the holidays and through New Year's. Our percent positivity has also significantly changed since the surge and since New Year's. We are currently at about a 4.1% percent positivity. This has been fluctuating between the upper 3s and the low 4s for the last few days. This is much more desirable than what we were just a few weeks ago. And if you'll remember that right around, I think it was just after the New Year's, we hit our highest percent positivity, which was about 12.5%. So we have seen a dramatic decrease in our percent positivity since that time, and now are below 5%, which is where we like for that to be. So that trend is also in a much more favorable direction. Hospitalizations have decreased as well significantly since the new year, where we were, had very high levels of hospitalizations, and now with 100% of our hospitals reporting this is an 18-county area, we are seeing a steady decline and continue to see that week over week within our hospital systems. This I wanted to share because this is what this is our Epi Curve to sort of show cases as they come in from their specimen collection date, and all that to say is that this sort of helps show what that surge really looked like. You can tell here, just to back up a little bit, if you go back to July, that was the summer when we had, that was during the summer when some of the restrictions had been lifted and we were seeing an increase in cases, and it felt like a lot then, but then you look at what happened right around November into January and can see that that clearly was the biggest surge that we've had in new cases since pandemic start, with the greatest number of those occurring, with that increase starting in early November, rising significantly and increasing exponentially, and then falling as the new year, as we came into the new year. And then you can see right there as we approach the end of February, starting to see the downside of that. And so while our new cases per 100,000 still is, at 171, which is still a high level, it is considerably lower. This Epicurve is also showing us that there was, lots of community transmission, lots of new incidents right around the time of the holidays, which we anticipated as people were going to get together, as more folks were going to get together with their families and even extended families or friends, and maybe not practice the 3 W's. And we saw the results of that. Our hospitalizations increased exponentially during that time. Our new cases per 100,000 did as well, not to mention also our new cases per day on average coming into the workflow, and our percent positivity reflected a great deal of community transmission. And it does appear that we are coming down on the other side of that surge at this time. It's probably a little too early to attribute much of that decline in the general population to any vaccine rollout, as that has been still quite small in comparison to, it just still in its sort of infancy as far as vaccine rollout is concerned, and probably not having a huge impact on general population transmission at this time. And then speaking of vaccine, did just want to talk a little bit about the rollout. This is just a state visual showing first doses administered throughout the state. And you can see we're over there in a really nice dark blue. That's where we want to be, getting lots of first doses out to our community. And as a whole, this sometimes is helpful that the entire state is just under, based on numbers from yesterday, the state is just under 2 million total doses given, with the bulk of those being first doses at about 1.25 million, and about 730,000 being second doses so far. Here in Buncombe, across all vaccine providers, we are just under 50,000 at this time, with again the bulk of those being our first doses, and then just under 18,000 being second doses. And then for Buncombe County Health and Human Services specifically, as just one vaccine provider, our total doses administered so far is just over 28,000, with again the bulk of those being our first doses, which makes sense. And then the second doses catching up slowly but surely as that 3 to 4 week time period now arrives. And just to let folks know that this is our dashboard or our infographic that's on our Buncombe Ready website, and it shows how many first doses we've received in the week, how many total vaccines we've administered, which you saw on the previous slide, how many first dose appointments we've scheduled, that we've scheduled this week, and then where we are on the current wait list. And so you can see the wait list continues to grow. And we are currently scheduling folks who are in the 15,500 to 17,500 range on the wait list, with a total number from beginning ongoing of over 54,000. So as we get down that wait list, more folks do come on it. So it seems it's staying right around 40, a little under 40,000 or so still on the wait list, with very limited vaccines still coming in. And I did want to note that we are still receiving two trays of Pfizer as our baseline. And they did recalculate that for 6 doses per vial. So that now comes in as 2,340 versus 1,950, what it was before, based on 5 doses per vial. So while that looks like an increase, it's really not. It's still 2 trays, but we did get a 300 dose bump from Department of Health and Human Services for equity purposes. And the purpose of that allocation is to work with community partners and make sure that we're reaching historically marginalized populations that may be underrepresented in either phases or access, and be sure that we're reaching our marginalized populations. And then I think this is my last slide, which is just the vaccine prioritization plan. We are now in group 3, frontline essential workers, but only childcare and school workers. That eligibility began this week, as you're aware. And locally, at the direction of our local leadership, HHS has created a hybrid plan to vaccinate childcare and school workers, in addition to continuing to vaccinate those in group 1 and 2, which remains quite high. We still have quite a big demand, particularly in group 2 for vaccine. And so there will be one tray set aside for school workers for the next few weeks to begin vaccinating that group. School administrators, but this includes private, public, and charter, were all given a form to fill out to complete with all of their staff that were interested in getting the vaccine and to submit that back to HHS. And from those lists, we will begin scheduling appointments first based on if the staff is school-based versus district or administrative. So bringing those school-based staff folks in first, and then administrative and district staff after that. But the appointments, the scheduling of those appointments will also, have equitable distribution so that not one school system gets all the appointments in 1 week. It'll be done in a way that there's some equitable distribution amongst the groups. Scheduling for that will start late this week, today or tomorrow, for the first group that will receive their appointments for Saturday. And we'll continue that process each week until we've run through the list. And I do not know how many are on that list because those were submitted yesterday at the close of business. So I do not have a firm number on that yet. I do want to acknowledge that our partners at MAHEC and the Buncombe Partnership for Children are working to provide access to our child care workers and early childhood staff. And so just to follow up on that you think it'll take still several weeks to get through the list. And if you had a week to get on to the list, and if you did not get onto the list by the time the school administrative staff turned it in, you've missed the deadline. And then staff who would then afterwards say, gosh, I really wish I had done that now, or I've changed my mind, I want on it, we'll have to go through the regular mechanism of getting on the wait list when it opens on March 10th for frontline essential workers. So I think that's all I have. I'm going to stop sharing, I hope, soon. Okay. Are there questions?
I had a question about the Epi Curve, which I don't think we need to go back and look at it, but just looking at where we are now, I was trying to visually estimate what level we're similar to from earlier in the year. And it looked like it was potentially before the summer small spike. Is that correct? Sort of what level we're comparable to now?
So what you're seeing now, actually, in terms of the percent positivity in particular, is actually we haven't seen the percent positivity that we've seen right now, which is, low, upper 3s, low 4s, since about a week before Thanksgiving. So before the surge, we hadn't seen anything quite that low. And then as far as the, that last part of that Epi curve is always in a sort of a gray area because test results are still coming through. So it's best to look just a little bit before that. And that actually, so you're at 171 new cases per 100,000, and the new cases coming in around 66. So that is, I don't have the summer in my notes right now, but it looks a bit comparable.
Thank you.
Madam Chair.
Yes.
Stacy, the wait list number, and it's probably way down the list of importance, but I'm just curious, the number of people on the wait list, that is a cumulative total from when you started taking people, is that right? And not active people who are waiting today? That's
correct. So that 50,000 that you see is cumulative, But that number where it says where we're working to schedule, that says 15,500 to 17,500, that's where we are down in the wait list. So we've scheduled up to about 15,000, some people, 15,000 have gotten their appointments. And so now we're scheduling in that group of 15,500 to 17,500. And next week, when we get our allocation, we'll move further down. It just, as we move further down, more people get added onto the wait list. And so that little marker at the bottom doesn't move quite as quickly, I think, as we all would hope.
Yeah, thank you. So we're truly at 38, 39, 40,000 approximately people that are still waiting who haven't had at least one shot on the Buncombe County wait list. Is what
That's
I hear
correct.
you saying. Okay, thank you.
Stacy, I happened to notice on your dashboard last night, it appeared that the county had been receiving something around 1,950 total doses, but for last week or this week, did I see 2,650 as a number? So that number is increasing. And do you have any feel for, since as Pat pointed out, 38,000 people 65 years of age or older in the first groups still waiting to get their first shot, do you have any feel for how rapidly the vaccine distribution will increase as far as the numbers of vaccines you're getting?
So that's right. We were getting a standard allocation of 1,950, and that was based on 5 doses in every Pfizer bottle.
Yes.
Now it's 6 doses in every bottle. So the baseline for 2 trays is 2,340. So we went from 1,950 to 2,340. That actually isn't an increase. That's just a recalculation based on the new files.
Right.
But the 26 you saw is the additional 300 that we got for equity. Okay. So we are seeing a little bit more in ours. And then I can say, just as a community, we have a couple of FQHCs that are getting it. Our hospital system is still getting vaccine. And now we have, through the federal program, we've got Walgreens, and I think it's about 8 stores in Buncombe County that are receiving about 100 doses per store. And so we do have overall within the county more vaccine coming into the space. As far as how many 65 years and older who are still left to get their vaccine, I can just tell you from our wait list, the bulk of that, because it's only been open to groups 1 and 2 right now, the vast majority of those on the wait list are folks who are eligible for group 2, which is 65 and older. Mm-hmm. I will tell you, based on what we've done as a county, and that means all providers, that roughly I think it's about 12% of our population has been covered so far. I don't have the age banding in front of me to tell you what percentage of what we believe is the 65-year group has been vaccinated, but I can tell you that the wait list as a proxy for what the demand is, it is overwhelmingly those who are eligible for group 2.
Okay. There's no prioritization if you have people that would qualify under group 1 maybe signed up. It's just first come, first served, first signed up, correct?
That's correct. Once the phase is open, you get on the wait list and have equal footing.
Right.
Now, when we open to group 3, the other frontline essential workers on March 10th, clearly because the wait list has already been existing, they'll fall to the bottom. But if somebody from group 1 and group 2 then decides, oh gosh, I really want to get this vaccine, they'll go to the bottom too, and so then it becomes equal footing. So the wait list opens based on the groups that are open.
Understood. Thank you.
Mm-hmm.
And Stacy, just to point out also that when we're talking about the wait list, that is not including our school staff, because again, you've pulled out that separate tray for them, correct?
That's correct, unless they do not initially indicate that they want the vaccine and the deadline is over, and then a school staff decides that they would like the vaccine, they are then directed to the general population wait list that will open on March 10th.
Great, thank you. I have one other question. Just was curious if you had had any comments or thoughts that you might be able to share with regards to the CDC's newest guidelines and how they match up to what we're doing locally in the county. And I guess I do have one specific question you might be able to help me with. So we are, based off of our total new cases in Buncombe County, considered high transmission red under the CDC guidelines. But the other indicator that they look at is the percent of positives during the past 7 days, and that puts us well below 5% in our low transmission blue. So, and the CDC's guidelines are recommending using the higher threshold for their guidelines to make decisions, I guess. But I'm having trouble, and this is where I think you could probably help me. Why are we still seeing such a high number of total new cases if our percent positive is going down? Has it just not caught up? I mean, so should we start to see, it just seems like a much slower decrease in the total new cases than what we've seen in our percent positive decrease. Does that make sense what I'm trying to ask?
Yeah, and I appreciate the question. Yeah. So we are still seeing a high level of new cases. And that, to put that in perspective, we were seeing as many as 400 to 410 new cases per 100,000 just after New Year's. So that's, those were really high levels at that point. And that fluctuated from that point of New Year's and until about a week or so after that, between like 400 and not quite to 420, but somewhere in those ranges. So that's quite high. And we were seeing new cases per day of about 134 new cases on average per day. And so what I think, so the one thing to remember is the incidence rate with new cases per 100,000 per week does look at that week range. And so, if most of your, it's sort of in a cumulative type of way and then standardized for population. And so, if you had a steady week of just, 50, 50, 50, but then you had 1 week where test results are coming in and you've got 100, then that sort of, beefs up that indicator. The big thing to note, though, is that it's consistently going down. The new cases per day is, when you look at that Epi Curve, is what is essentially what's happening there, which has gone from 134 new cases per day to about 66. So that's about a 50% decrease as well. And so the percent positivity is then also based on how many tests are being done and what percent of those are coming back positive. And I will say, at the time of the surge, we had almost 10,000 tests per week being done, which was the highest I had seen since becoming the health director here. It is now stabilized back to, anywhere from about, on average, about 7,000 or so per week. And so we are seeing that stabilization of our testing again too, but in that stabilization, still seeing low transmission rates. And so I think that what you're seeing is just that we had great number of community transmission, lots of people impacted, and still have folks who are being impacted, but that decline is showing significant improvement to the tune of 50 some percent. And our percent positivity is reflecting that as well, even though the testing numbers have returned to what pre-surge it looked like.
See, I had a question. When we're calculating the cases per 100,000, what happens if people from outside of our county are coming in to be tested within our county? I'm assuming that doesn't get added to our total population. The number is still being based on our total population, but in theory, that could inflate that number.
New cases or any new positive case is designated to its county of residence. So even if folks come here to get tested, if they are not a resident of Buncombe County, their cases nor their test positive, their positive test is not attributed to Buncombe County. So if you were, from Henderson County or another neighboring county and came to one of Buncombe's testing sites, you could get your test here, but your positive result would still be attributed to your county of residence.
Got it.
So Stacy, can we expect to see the total new cases, I guess, continue to go down at the level that it's been going down in the next couple weeks, just given all the other factors that we're kind of been looking at? I guess for me, I'm just trying to wrap my head around the CDC guidelines that still put us into the high transmission red, while we are looking favorably just based off of our local metrics. But I can't help but see that the CDC guidelines is still putting us in the high transmission. So I'm just wondering if in 2 weeks, and I know you don't have a crystal ball, but if in 2 weeks we could expect to see that be cut down by another 50% if things continue on track the way that they are going in our county. That might actually put us in the substantial as opposed to the high transmission.
So I don't have a crystal ball. I can tell you that the trends right now look very favorable, but a lot of that depends on you and me. It depends on us continuing to practice the 3 W's, even though things are getting better. So this is one of my big messages to folks, is that the trends are getting better, but that doesn't mean that it is time for us to stop doing the things that matter. This is actually the time to continue doing the things that matter so that we can continually see those trends go down. I will tell you that, this is looking at the Epi Curve, watching it fall. It has been, very encouraging that it is becoming much more favorable. Our percent positivity is in a really great place. It is still a high level of incidence, but falling, pretty consistently. But those trends will only continue if we continue to make sure that we are wearing our masks, that we are keeping our distance, and that we are washing our hands, and that we are limiting our interaction with others. And so that has to be a component of this. And you all have lots of things to weigh. But, one of the things that has been pretty consistent with, the school guidance has always been that, being able to practice those precautions as much as possible as well. And so this is where it's important for folks outside of the classroom to help you. And that, that's the piece that we've talked about before too, is that this has to occur outside the classroom too. And, not only our schools, but our families and our caregivers of children have to remember that what we do outside of that classroom impacts the classroom. So, just stressing the messaging and the communication that goes to our community and to our families, and that now is we have to remain diligent on making sure that we practice these things outside of the classroom, in our homes and with our neighbors, and when we're at the grocery store, or all of it, or when we visit with family. that these are the things that we have to remember.
I have another follow-up question based on that. We continue to talk about the importance of the 3 Ws, but we're at a point now where our state level Health and Human Services are saying, and our governor rather, are recommending that if at all possible, we go into Plan A and have as many kids in school as we can, knowing though that we're not going to be able to maintain 6-foot distancing in the classroom if we do that. And so hearing you say we need to continue to follow those 3 Ws, but then at the state level, we're getting recommendations that we can actually limit that in the classroom to a smaller distance. Can you help bring that together?
Yeah, so the 3 Ws are additive. When we do them all 3 together, they are the most effective, right? And so the balance for you all is then, making sure infection prevention is looked at and is you're being attentive to it, and also the needs of the learning, the educational needs of children. My expertise is over here. You all have to balance the 2, but one of the things that we talk about all the time is that the 3 Ws are additive, right? So when we cannot maintain the 6 feet, this is where masks are really important. This is where washing our hands are really important. This is where disinfecting and decontamination is really important. This is where, for particularly schools, ventilation is really important. Because they're additive. When they're all working together, we have the greatest opportunity to reduce spread and transmission. So when one has to, when one can't maintain 6 feet, that means the rest of the precautions have to be really honed in on. And that if it's maintaining somewhere less than 6 feet, that is everyone wearing a mask? Are we making sure that our hands are sanitized and washed as much as possible? Are we wiping down surfaces as much as we can? When we can, are we keeping folks at a greater distance? When we can, are we utilizing bigger spaces and outdoor spaces? So all of those things have to be considered.
Thank you, that's helpful.
Stacy, we appreciate your time, and I know you have a very busy schedule. I think we've probably held you over a meeting that you're soon to be attending. So again, many thanks. And at this time, we're gonna ask April Bauer, I believe is with us, and April coordinates our school health nurses who are our VIPs, and we're gonna hear a little bit more about the testing availability in our schools, and as always, I'm sure you'll talk to us about the dashboard.
So thank you so much, Dr. Ball. I just wanted to say thank you all for your time, and you are in very good hands with April. You are right about that. She and the school nurses team is a great resource and definitely VIP. So thank you all for your time. Have a great afternoon.
Thank you.
Thanks. Can you guys hear me okay? Okay. Yep, so just kind of checking in on the testing. That has started, our rapid antigen testing in schools, and it's going really well. We are testing students and staff if they meet the criteria. So far this week, we have done 11 tests at school, and we've had 1 of those come back positive. And the benefit of having that positive result right there at school is that we were able to, of course, have the person immediately begin their isolation period. And then we were also able to identify any close contacts that person had at school, and they could go ahead and begin to quarantine. And because we can add the information about the positive test into the state surveillance system, then we can go ahead and start that case investigation, contact tracing process that we've talked about. So I think that's going really well. We are still working to increase capacity for testing. So we're trying to come up with options for students if they're at school and the nurse isn't on campus that day, that they can go to the nurse's other school or to another district school. We're also considering whether we may be able to train some additional staff to support, but testing is going well. So I guess I'll pause and ask if there's any questions about that. No? Okay, and then, our dashboard is still being updated weekly. Of course, with students back in the building, you're probably going to see a few more cases reported on the dashboard, but our overall trends are still declining in terms of the total number of school-related cases that are being reported. They have consistently been trending down since we've had our major spike after the holidays. So I think that's, reflective of our community rates right now. We're seeing pretty controlled transmission, I would say overall, but definitely, echoing what Stacy said, that, just things look great, and that's the time to make sure that we're continuing, with our safety measures and not relaxing them, because we want to keep things in a good place, especially with vaccines starting to be, more widely available and really having an impact on our community. So questions about cases or anything else school health related?
Madam Chair, if I could ask a question, I don't want to jump in front of anybody. So the data nationally and worldwide seems to indicate pretty clearly that our youth, and I want to focus in on our K through 5 age, are much less likely to have severe issues if they get COVID, and much less likely to get it. I'm curious what you've seen recently, and you be the judge of how far back recently goes with the data you have, what you've seen since we've started the testing of elementary age students, kids at that K through 5 age, 10 and under in Buncombe County schools.
So I will say so far for our in-school testing, and we've really just gotten that started, but we have not yet had any positive K through 5 student results yet. And I'll say just in general, when we're talking about school-related cases, we are seeing, cases occur in all age groups, but I do think that, the data that we have so far does tend to support that younger kids may be less likely to get or transmit COVID-19.
And to follow up, so since we've just started the testing, do you have some analysis or some feel for how that has gone? Granted, the testing wasn't in our schools, but prior to now, what we look like in Buncombe County schools when we have had positive tests in terms of students, what that looks like in K through 5 compared to older ages.
Oh, goodness. I don't have that specifically pulled out. I can tell you just anecdotally from looking at it that, it's been, I wouldn't say necessarily significantly heavier distribution among middle and high school students, but a lot of times what we're seeing, with younger kids is that they may be getting tested because they have someone else in their household who's positive, so they're not as likely sometimes to have symptoms. And so, I think that there's also a difference in how the cases present sometimes among younger versus older students.
And then to tie it all up, the clusters and overall numbers, without putting words in your mouth, do you feel like we've done a pretty good job in a variety of different ways in Buncombe County schools of keeping spread from happening in our school buildings at all ages?
Yes, I do. I think we have really strong protocols in place. We have our screening processes. The school nurses, as I've talked about before, do follow up with every single student who's excluded as part of that screening process. So we're able to support students in getting tested if they need to, and getting back into school as quickly as possible, when it's safe. And then, like I've also mentioned before, being able to do that case investigation and contact tracing in real time has been something that's not happening everywhere in every county, but our school nurses have been able to do that, and I think that's also been a huge part of really keeping transmission low.
Thank you.
Mm-hmm.
April, if I may ask a question, if you'll just help me understand it. Let's imagine a child arrives at school, they are checked, they're screened, temperature's okay, but later in the day, they develop a low-grade fever, maybe 101 or whatever it may be. And so the school nurse becomes involved. Two-part question. Number one, does every school have the capability of administering the rapid test, or does a school nurse maybe in the district have to be summoned to that school to perform that test? And secondly, what criteria is there? The parents have to sign a permission form to have the test performed, or is that something that the health department can basically just do? If you could answer those questions for me, I appreciate it.
Sure, yep. So the school nurses are the ones who are trained to administer the test. So if they're on campus that day, you know, when the student hypothetically becomes ill, they can do the test right there. If not, then we do have options for, you know, when the parent or caregiver comes to pick the student up, because they do have to, right, because they're excluded based on the symptoms, and they can take them to the closest school that does have a nurse on campus for testing. We do sort of a drive-up curbside swab. So we've, you know, made that pretty available. And then as far, oh gosh, I lost the second part. Can you remind me what you said? I'm sorry.
The second part is,
Yeah.
does this require any specific
consent.
consent?
Yes.
Yeah.
Thank you. Yeah, so we are right now getting verbal consent before we administer the test. So we're calling the parent or caregiver. The nurse is getting that consent over the phone. And North Carolina does have, you know, for diseases that are reportable, communicable diseases, there are cases where minors can actually consent to treatment related to those conditions, but we're not going that route. Really, we are getting parent or guardian permission before we do the test.
Thank you.
I have a question about the dashboard, just a clarifying question. I'm looking at it now. And so the dashboard has 3 columns for each school. The first column being new cases as of the date, the second column being active cases as of that date, and then the third column being cases released from isolation as of that date. My question is about the third column. Is that a cumulative total since the beginning of this dashboard, or?
It is.
Those numbers are very high. So my first thought when I look at that is, oh my goodness, since last week we've released 13 in one school, but that's not the case, correct?
I accidentally hit my space bar. Yes, that is actually just a cumulative number. So it is the, you know, every week the new cases, and then those cases that were, you know, previously reported but are still in isolation or in that middle column, and then anyone who's been cleared after being previously reported is in that third column.
Okay. Since the beginning of the dashboard, or how far back
Since
does
the
it go?
beginning of the dashboard.
Okay, thank you.
Yes.
April, I have a quick question. Are you able to, do you know, like out of those that you said you had administered 11 of the rapid test, did you have parents that declined the testing? And if so, do you have a number for that?
Not that I've heard. You know, I would have to send that out to the school nurses to make sure that I haven't missed any, but no one has reported having a decline on the testing. I think for the most part, you know, our parents and families are really glad to have that opportunity because, you know, their student can get tested right there. They don't have to go to another site, locate a testing site, or go to their provider. You know, especially if the test is positive, then they can just go ahead and start the isolation process. But I could ask and make sure there haven't been any that I'm not aware of.
Sure, well, that's great. I'm glad to hear we have the buy-in. I guess, and then my other question you might not be able to answer, but do you know how many classes in Buncombe County schools are currently having to be quarantined as a whole, as far as going from in-person to remote?
Yes, right now, my understanding is that we have essentially 2 classes total, and those have a larger quarantine pool because of the age group, and just some challenges, you know, with the, I guess, strict adherence to the protocols. But most of the time, if we have a positive case, even if it's in the elementary school setting, we are able to determine that there's, either no close contacts or there's maybe one or two, and only quarantine those that are affected. It's not typical that we quarantine an entire classroom.
And that would be because we are currently following the 3 Ws that we have in place under our Plan B.
Yeah, so the close contact, guidelines are that 6 feet, they have to be less than 6 feet for a cumulative 15 minutes or more. So if a classroom is able to maintain their distancing and they are, really following that strictly, then they don't have to, there aren't close contacts if there's a positive case, because they haven't been in that range to be considered exposed.
Great. Thank you.
April, let me ask one question. I know we have constant revisions to CDC, to state DHHS guidelines for our protocol and our toolkit. Any recent changes as far as the time limitations, the actual definition or identification of close contacts, quarantine, isolation, any changes recently in that?
Not super recently. The only things that have changed really at all as far as close contacts is that several months ago, the CDC changed their definition of a close contact from a continuous 15 minutes to being cumulative. But in North Carolina, we were already using a cumulative 15 minutes. So that didn't change our process. Isolation processes have not changed. It's still 10 days from symptom onset or from test date, unless you have one of those severe cases that does the 20-day isolation period. Quarantine changed a couple of months ago, and that's where we have now multiple options for the length of quarantine, depending on whether somebody has symptoms or whether they get tested. So a 14-day quarantine is still best practice, but people do have the option to discontinue quarantine at day 10 if they've remained asymptomatic after exposure, or day 7 if they have remained asymptomatic and have been tested negative on or after day 5. But if they do end quarantine early, they do still have to follow those safety protocols and self-monitor through the remainder of that 14-day period.
Thank you, April. Madam Chair, again, on the board's behalf, I'd just like to thank April for all of her efforts and leadership and working out in the schools, and we're very proud of our school health nurses. Very fortunate to have the quality of those nurses in our schools. So, April, thank you for your time.
Thank you. Y'all have a good day.
Thank you.
Bye.
All right. I guess we're going to do the Pledge of Allegiance, so we'll go back to the beginning, if that's okay. If, at this time, we'll do the Pledge of Allegiance.
Color guard, attention. Carry, colors, forward, march. Mark time, march. Color guard, halt. Present, colors.
I pledge allegiance
to the flag
of the United States of America
and to the republic for which it stands,
one nation, under God,
indivisible,
with liberty and justice for all.
Order, colors, left, face, forward, march.
At this time, I'd seek a motion to approve the agenda.
Madam Chair, I move that we approve the agenda.
Thank you. Could I get a second?
I'll second.
Thank you. Have to do a roll call.
We do not, since all board, no, we do, excuse me.
Pat's
Mr.
up
Queen, and yeah, so we do need to do a roll call.
Pat Bryant,
Aye.
Amy Churchill,
Aye.
Amanda Simpkins,
Aye.
Max Queen.
Aye.
Are you with us?
He was muted.
Can you hear me?
I'll come back to Mr. Queen. Cindy McMahon,
Aye.
Peggy Buchanan. Aye. Ann Franklin, yes. Max, are you with us?
Yes, I am.
Do you approve the agenda?
Yes.
Thank you very much. Now it's on our agenda, it's the information agenda, and I'm going to ask Dr. Baldwin to continue to work with us on this. Thank you.
Madam Chair, we have several of our district leadership team members, and this is all about numbers. We thought it would be of interest, especially with the consideration for potential transition, for these numbers, for you to have access to them and hear them. So at this time, I'm going to ask our very distinguished Director of Testing and Accountability, Mr. Steve Earwood, to come up and talk with us about the change in numbers from prior to the holidays to currently.
Somebody else when you said distinguished.
Are you comfortable removing your mask so we can hear you? Thank you.
I'm sorry, just bad habit, or not a
Thank
bad
you.
habit, I
Good
guess it's a
habit.
good habit.
I guess it
wouldn't
is,
think about it. So wanted to talk to you about the vulnerable populations that we're serving. You know, took a big break, so to speak, that we had, and we wanted to make sure that we continued that. So this is based on the last few Wednesdays that we've had, where we've been able to bring students back into the school on Wednesdays. As of today, in fact, this is, you know, just collecting what we did from yesterday, we had about 2,100 students, a little over 2,100 students that we brought back into schools on Wednesdays to provide some supplemental services for them. Just to remind you, if we're going back to the fall prior to our break, we were serving about 700 students. So, you know, about 3 times as many students we're bringing in right now for services. And of course, that's based on the data that we gathered from first semester to see the need in being able to do that. Now, I will say a lot of the principals that offered comments as well, when I spoke to them, said, you know, we're bringing in this many, but next week, we're planning on bringing in a lot more. So this number could potentially significantly increase next week as they build their capacity and figure out what they can support. You know, one of the things we were looking at is the number of students that came back after this prolonged break. So I was gathered a poll to all the schools about, you know, how many bodies are coming in the building. And I can say based on the numbers that we have in Power School for what we expect, you know, those that are listed as A Day, B Day, or A Plan, or A Day, B Day, D students, which are the 4-day a week for staff members, we are almost matching exactly what we expect, probably about 98%, which is a typical attendance. So the students did come back. Again, changing into a different plan, then we'll have to revisit that whole process again, because obviously it changes every time we change. So, were there any questions about?
Can you clarify what you just meant? Did you say that 98% of our students currently are participating in face-to-face learning? Is that what you said? I'm sorry, I was confused.
No, ma'am, I misspoke. We're seeing about 98% of the students we expect. So when you look in Power School, we can see which students have said that they are a plan, or a face-to-face coming in A Day, B Day. We know which students are A Day students, which students are B Day students. So the
What
numbers that
percent
are,
of students are like wanting face-to-face? Sorry, what percent of students are wanting face-to-face instruction? Or better yet, what percent of students are wanting to stay full-time remote? Do we have that?
I do. I'll have to calculate the percents. I've got the raw numbers. So for A-day students, we currently have in Power School listed 7,327 students. For B-Day, it's 6,827 students. Our D students are our staff member students that have the option of coming 4 days a week. We have 968. And remote students, we have 6,815. You know, so if that's a total, when you look at the total, it's almost 22,000 students. So, is that answer?
Roughly, yeah.
Yeah, it's about 30.
Yeah, it's about 30% remote. Now, what we were concerned with is, like I said, we wanted to make sure that, is that really what's happening? You know, we know that it's 30% listed. Is it truly 30% of what's coming in? And that's what we found out, that those students that have indicated they want face-to-face are coming.
Thank you.
And that's where you're getting your 97% from, is 97% of those
Yet
that are like
98% of the A-day students
Are attending.
came on their A-day.
Okay.
Yeah, so, which is, like I said, that's a typical attendance rate in a normal year.
Good to know. Thank you.
So you have 2 or 3 that are absent.
Right, exactly.
Uh,
And now granted, it's a
Steve-
small sample size. We've only had 2 B-days for this, so small sample size.
Steve,
just did the math.
Madam
Maybe
Chair
did
just
too.
mentioned,
30.
had a comment about some are absent. And roughly, if you're looking at 98% have returned, 2% who have not returned. Some are still enrolled, but I'm hearing reports of excessive absences, in one case exceeding total number of days for the year, I've been told exceeds 100. My question is, and I don't know if you're the right person to address this to, or Ms. Swanger, but how are these children going to be, how are they going to be handled as far as remediation and or moving them on forward into the next grade? Seemed like if you moved them forward in the next grade, it would be just setting them up for failure unless they get some type of remediation.
Absolutely. I'm not sure I think Ms. Swangers probably has a better handle on that.
Great question, Mr. Queen. What the state will be, as we're watching what's coming forward, summer school will be offered. We want to make sure that that student has the opportunity for a face-to-face parent-teacher conference, including the principal, looking at the at-risk team and what are we doing per se, what are we offering for that student to have extra support. If the family or the student is not committed to that student attending those Wednesday sessions, next step will be summer school. If no summer school and the progress is not being made, we will have to retain that student. We can't put the student in a situation that they are not able to grow academically and be prepared for the next grade level. But we should be seeing all of our students providing Wednesday services and then offering a summer opportunity because we know we're in the recovery phase.
Right, right. Thank you.
Steve, I know you live in a world where you want exact numbers, but I'm going to ask you ballpark. It appears to me that when we're looking at the change, because we did allow that transition period to choose from remote only to a B or A or vice versa prior to the holiday. So it appears to me there's been maybe up to about a 10% swing. Is that a fair estimate?
Absolutely. When we have actually been tracking this about monthly, those changes from remote to face-to-face. Back in the fall, going back to September, we were at about 40%, September, October. Now we're down to 30% that are requesting remote-only instruction.
31.1% to be exact.
I have a question which may go back to you again. I'm imagining that the need for summer school this year is going to be tremendous compared to what it's been in the past. Do we have, what will that look like funding-wise? I mean, or am I way off? I mean, I'm thinking that it's got to be at least double.
If you remember, many years ago, we had a summer school for promotion grade levels 3, 5, 8.
Yeah.
And we will be back to a K through 12 summer school. And if you'll watch House Bill 82, that's the parameters that we'll be working from. We've always offered a reading camp for K1 or first, second, and third grade students. And so we will be expanding that to include science, math, and reading. So far, the bill says that we should have physical activity, and it should be fun. There should be some enhancement opportunities. So that bill will determine the hours per day, the days per week, and then we will be using some of our funding sources that are coming to us to offer that. Our high school students always do credit recovery. They always do some online kinds of courses, so that will continue. Again, just expansion. Really worried about our Math 1 students. That's an area that we need to address, catching those students up, especially those transition years. I would also like to see that we can do something for our incoming kindergartners. So we really have to think K through 12. Middle school students, we saw last meeting that those were students that we're worried about not doing as well academically, more attendance issues, so really want to target those. But clearly the law says it has to be a parent's choice if a student attends. So we have to have some really frank conversations with parents and really make sure that they feel invited. We'll offer bus transportation. So school will be in session this summer.
Got it. Thank you.
I might just add, there is a reference, there's a current House bill that I would predict would soon be ratified in both houses, and be coming to the governor very soon. So the timing is such that I'd also predict that at our next Thursday regular monthly board meeting, you're going to have considerable details regarding what that plan would look like, at least the tentative plan, as well as the financial source for covering that. And that is some federal funding that we're going to be certainly from the get-go. It's going to be all about recovery. And one other thing I just want to reference to Mr. Queen's question. Remember, I think that question was reference to academic recovery. We cannot forget in this school system that there's an equitable area of recovery, and that's social emotional health. And in many ways, that is certainly equivalent, if not more important, for our kids going through COVID.
Absolutely. Counselors will be on staff. And again, it has to, what a great way to bring students back into our buildings, building those routines, finding those gaps, and having a chance to mitigate those.
I would say that was a provision that was actually added to the original bill, was to require SEL instruction in summer school.
Very important.
And can I just ask too, are we also talking about enrichment opportunities and not just recovery opportunities? Because I think that we can also look at the other end of the spectrum, in that there are kids that maybe didn't show growth that we expected them to show, that might be on, like our AIG children, that might benefit from some opportunities for enrichment programs.
Yeah, that bill does require at least one enrichment activity every day for students, K-8.
You know, students can be at risk for many reasons. It could be academic, it could be social emotional, it could be a lot of things. And if we narrow that decision and that qualification too much, we'll leave someone out. So as long as we have numbers that we can manage safely, and we have enough staff who are willing to work, because that's the other area, we have to have teachers and staff who want to work this summer. So all of those things will be taken into consideration.
Okay, thank you.
I want to thank Mr. Earwood and...
Dr. Baldwin, I've got
sorry.
a couple questions for Mr. Earwood, if I could. So the testing data and all the information you gave us at our last board meeting for first semester, there was a lot of information there. Clearly, at least for me, the most alarming number was the number of absences. And while I think it's good that we're at 98% of those kids that are in the building, I'm curious what the numbers are from January forward of our absences related to the days when kids are not in the building, those virtual days, whether they're all virtual or whether it's the days when they're an A student and they're not in the building or a B student and not in the building, one. And number two, if you, and I don't care which way you answer this, if you could kind of expound on what is the day like on Wednesday? And I'm specifically thinking about middle and high school kids. For example, a ninth grader who really needs some help in math. I know our buses are running. Are they working on, in that example, on math all day, or is it similar to a regular school day? What exactly is going on for those kids on those Wednesdays when we're bringing 2,100 in?
Yeah, Wednesday it's typically, and I should have added that, you know, we were serving students remotely before students were coming back in the building. That has not stopped either. We're only looking at the students actually coming in the building, but we're also serving a large segment virtually on Wednesdays. So it's even more than the 2,100 that we're bringing in that we're serving. A typical day on a Wednesday is 2-hour block, and it's because it's just for, you know, help in that class where they really need it. So it's really individual with that teacher, you know, just whatever the need is, and it can be a myriad of needs that they're serving. But they would come in for about 2 hours, some school 3 hours, depending, you know, how they've got it set up. But it's just a 2-hour block of extra help.
But we are busing them, right? The ones that need transportation?
We do provide bus transportation.
And so we're taking them home at the time that block ends, not at the end of what would be a normal school day. Is that accurate?
Correct, correct. So they may come in and say, we kind of try to do like a 10 o'clock so that we can feed them before they go home, you know, give them a meal and take them home at maybe 12 o'clock. You know, some are offering a morning session, an afternoon session, just to try to, you know, for the load, to help with the load and to accommodate the needs of the student.
And the absences, the absences, what are we seeing compared to first semester? And if you don't have raw numbers, that's okay, but if it's similar to what we were seeing, that's kind of what I'm looking for.
Yeah, I'll be honest with you, I wouldn't even want to say what the absences are without checking. I'll be honest with you, I have not looked at attendance data since we've come back.
Okay.
For Wednesday, we have to remember those are days that students work independently. It's asynchronous.
Right.
So they have a period of 5 days to complete those assignments and turn them in. So it's always running behind in terms of counting. We, after first semester data has been shared, we asked every teacher in Buncombe County to spend at least 2 hours on Wednesdays offering individual support or small group support. It could be in face-to-face or it could be remote. In addition to their regular time to gather work and post assignments for Wednesdays as well. So the students coming in for assistance on Wednesdays are still having to do their regular daily assignments, but that 2-hour block or 3-hour block of which they're coming into the building is in addition to their work for the day.
Right, no, I understand that. It's just, it seems pretty clear to me that kids want to be in the building, that we're going to Dr. Baldwin's point, that connection, while we may feel that we're doing really well on Monday through Friday in a lot of different ways virtually, it's not the same.
Oh.
No.
And we are, those absences just jumped out at me from that first semester look at the numbers, how many kids are missing and considered not there. And first semester we had everything from all virtual C to B, and we went back, if I get it, but across a full semester, those numbers were just eye-opening to me, and that's a more important thing in my mind for us to be looking at and trying to figure out how to handle and battle and deal with that. I'm happy we're at 98% of the kids that could be in school on a given day, whether they're A or B, are in the building. That's great. But that also speaks to me that that's really however we can best, at whatever age groups we can best do it, getting more kids in the building in some way is the way we need to try to go. Whether that's today, next week, the week after, this summer, federal dollars, I know you've had a conversation with me and mentioned it today, some state monies, whatever we can do, whether it's called summer school or summer camp or enrichment camp, or some combination of all that, you know, working to reconnect physically kids into our buildings, that to me just seems to be kind of where we focus. And I know that's what you're doing, but it just, those numbers were just eye-opening to me.
Can I just add one thing that I've been learning in the Reynolds district about the Wednesday sessions is that, at least in our district, it seems to be going much more smoothly at the middle and high schools than it is at the elementary schools. And I don't know if that's true across the system, but the principals in my district seem to say that it's a developmental thing. And so coming in on a Wednesday for a shorter period of time or something that doesn't feel quite as much like their normal school day is more comfortable for those middle and high school kids than it is for the elementary school kids. And so it tends to be a little bit more chaotic, is what I'm hearing in the Reynolds district anyway, at the elementary level on Wednesdays.
Well, the age of the child certainly, and childcare, it does cause some complications for certain.
You know, and I might add, we're so used to thinking in terms of numbers with attendance and absences. I think, even though more subjective, I think a better way to consider this from our student standpoint is engagement. That's not necessarily easy to evaluate, Steve, or to put a number on, but it's that engagement piece, and that can certainly range, and it certainly ranges in terms of the age levels. Ms. McMahon.
And I will just say that in the Robertson district, I know that there are many, 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 many elementary classrooms that are, and they chose even before we asked for the 2 hours to offer a Zoom class on Wednesdays, just because they felt like they wanted to just continue on with the lessons that they had been doing remotely for Monday and Tuesday. So they were taking that opportunity to just go full speed ahead. So it may not have been kids actually coming into the building, but they still offer that opportunity for that face-to-face by computer to have that live teacher communication between student and teacher.
At this time, I'd like to ask, and I'm sure both Steve and David share dreams about numbers in their sleep. So I'm going to ask our Director of Transportation, Mr. David Roney, to come up and give you some insight on those numbers.
So you'll have to forgive me, I have not watched the first hour of this work session. We have been absolutely slammed today, so you can catch me up as we go. So I'll give you some numbers, and then as you develop questions, feel free to stop me at any point. So we've only had, as Steve said, we've only had one real B day since we returned from holiday break. Today is the second B day we've had. We were out last Thursday. So it's really hard to determine off of one afternoon route how many B students we have on buses. Now we have all that data, but it's just one day. So what we did is take every school in our district, reported every student that rode the bus that morning and that afternoon, put it in a spreadsheet. Obviously, a student that rides bus 56 in the afternoon on A day and the group that rides that bus on B day, if you add that number together, that gives you a decent idea of how many kids are going to be on that bus when we go to a Plan A for K-5 or whatever, K-12. So we tried to do that, keeping in mind that if we go to a 5 days per week school, that we believe our numbers will increase. Because again, that is a situation where if my student is an A-day student, that's only 2 days a week that I have to provide transportation. If we go to a 5 days per week, then certainly we feel like, and we want kids riding buses. That's what we do. We feel like our numbers will go up, our ridership will go up. So with all that said, in a Plan A situation, staying 1 per seat on the school bus. So if we stayed Plan B for transportation, we would have, and this is just based off the numbers, not off of any projections of increase or anything, we would have 16 of our elementary schools that would have a severe busing issue. Of our intermediate and above, and I'm just talking about ridership, I'm not talking about anything other than 1 per seat in 16 elementary schools, it would cause an issue with the number of routes that we would have to run per bus. From 6th grade up, we had 6 schools that would really have a difficult time with that 1 per seat requirement. So that's kind of in a nutshell where our numbers are. I'm sure you have questions, so I'll be quiet and let you ask them.
I have a question. I know that in normal times, we absolutely want to increase our bus ridership because that's where our funding comes from. But I wonder if in this situation, it wouldn't be prudent to ask parents that can allow their children to be car riders and encourage them to let their kids, come in the car and be picked up by the car. We've never done that before. It doesn't normally make sense, but it certainly seems like it makes sense in this situation. I would hope that none of our funding for next year is going to be based on this year, surely.
So our budget has been held harmless for next year. However, it is a huge portion of our budget is based on ridership. So we're always a little hesitant to say, please bring your child to school, because once they figure out the workaround for that, maybe 2 years from now, 3 years from now, they're still doing that. We're always hesitant to tell parents, bring your child to school, because it is a major part of our funding. Even though, yes, we are held harmless for next year, again, once you get people into habits of doing things, those habits oftentimes are hard to break.
The other thing that I've learned this morning, actually, when I was at Fairview, is that what that does is kind of solve one logistical problem and creates another. Because the more car riders we have, especially right now when we're taking everybody's temperature and everything, it's slowing. If we're in Plan A, it's slowing down how long it takes for everybody to get into the building, and therefore there are issues with scheduling and staffing and all kinds of sort of domino issues that come along with having more bus riders, even if that helps. Car riders. Even if that helps us on the bus rider end. Does that make sense?
It does, but I will say that I've had to take my child to 2 different schools this year, and maybe it's just that they're very efficient schools, but I have not, it just hasn't, it's very efficient in the morning at drop-off. There's like 6 people out there with thermometers. We roll the window down, and it takes them maybe 2 seconds longer to get out of the car. They ask the questions, and then they help them out of the car. I don't know. It's definitely been shorter for drop-off this year than it's ever been in the past. And I would say that's because there's, less people. We're on B Day, but I feel like we're making the bus thing a roadblock to bringing the kids back in the school. I feel like the transportation is one of our biggest hurdles that we have to jump. And I understand, I get it. Because I always encourage my kids to ride the bus when I was a teacher. I get that that's where our funding comes from. But ultimately, if we have a solution for that, we need to figure out what that is.
So So there is a solution, and Mr. Bryan has mentioned it in previous meetings, and if you'll allow me to use my phone, because I took a picture of this because I wanted to read it exactly how it's worded in the toolkit. It says local education leaders and schools should follow the guidelines below for their transportation vehicles. It is strongly recommended that a school operating under Plan A for K-5 grade students should utilize a more restrictive Plan B approach for school transportation. So it's not a requirement.
Right.
It is a strongly recommended. So
if we don't go one per seat, we don't have the huge issue. Is that what you're saying?
If we were to institute a Plan A for schools.
Yes.
And the board would say also we're going to do Plan A for transportation.
Correct.
Then at the K-5 level, we do have the ability to do that.
Okay.
And that is how many per seat?
There is, and I've gone back today and made a few phone calls and gone back through. There is no restrictions. It just simply says Plan A for transportation. So again, I would think that would give the board autonomy to say what that looked like.
With the way they define Plan A, it seems to be minimal social distancing. That's the way they.
And I've talked to many school systems who are using similar situations. The best one that I have found is you use Plan A transportation when needed. So if you have 20 kids on a bus, it's one per seat. If you have 30 kids on a bus, you can't be one per seat. So this is the way they did it. The first two people to get off the bus, they're going to sit in the first seat together. That, again, minimizes the amount of time that they're in close contact. And so you unload the bus. The kid at the end of the route is in the back seat by themselves. Because, again, everywhere you can, you use one per seat.
And it seems like if we have assigned seating on the buses also, then you limit, you're not sitting with a different kid every day. If you sit with the same kid every day, then that also would limit exposure, I would think.
That's correct. And by and large, our routes are done. If you are the first kid off the bus, you're the first kid on the front seat because you don't have to walk by every student on that bus to get off. In the mornings, if you're the first student picked up, you go to the back of the bus, again, minimizing the number of times we pass by people.
You're all raising really great points in what we're considering with transportation, and everything that you're discussing right now are those methods of mitigating, as things are now. I will just add to it that as we bring before you a recommendation today, it takes in consideration, and I'll say this word very clearly, the possibilities of when Bill 37 comes out, which I know Mr. Campbell will talk more to you about that. In the way that we'll be making this recommendation, it may provide additional mitigating steps that will help ease the bus situation.
I think bottom line, though, the board needs to understand this. If we move in the direction of K-5, because right now, that's the only direction you can go in terms of Plan A. If you move in that direction, from a bus transportation standpoint, along with that decision, it's a parallel with spacing in the classroom. Okay, this is what we live with. This is what the state guidelines, by the way, suggest now. Our toolkit, which is our Bible in terms of operating in COVID land in our schools. So we'd have to understand that with that decision is the allowance for 2 per seat K-5 on these buses. I'm just going to cut to the chase, David.
Yep.
Good. That needs to be understood. And we also need to understand that systems all around us have been functioning under that Plan A, 2 per seat, for a long time. Now, and again...
and I would add, Dr. Baldwin, without problems.
Pardon me?
Without problems.
To our knowledge, without problems. And now the issue remains, and with intermediate schools, our 4 intermediate schools and the transportation there. Because again, the toolkit does not give the allowance of the recommendation. It still remains under the requirement if there is any additional grade above 5 on that bus. Now, there's some potential you're going to probably hear some of that alluded to by Mr. Campbell in looking at the crystal ball that may provide some additional flexibility for you, the board, to assist with that issue with transportation. But right now that exists. That's the one area in the requirement piece that is going to be most challenging for us.
Right, and I took a picture of it because, so if a school transportation vehicle serves kindergarten through 5th grade in addition to other grades, our intermediate schools and intermediate, and if they shared with middle school, until further notice, the school transportation vehicle must operate under Plan B. So anywhere there is a 5th K through 5 on the bus with anybody 6 and up, we are required to be 1 per seat. So that really creates a difficult situation at our intermediate schools because that's 5th and 6th graders on a bus together, so we are required to be 1 per seat on that school bus.
Is there a possibility of a 5th grade route and a 6th grade route if for some reason the rule doesn't change?
Say that again.
Is there a possibility of a 5th grade route and 6th grade route if it doesn't change?
We talked about that the other day. The problem with our intermediate schools is they cover the entire school district.
Right.
So, you know, a 5th grade route, you dismiss at 3, you're going to get back at 4:30. You're going to load those 6th graders up at 4:30. You're going to get back at 6. So it's a possibility. Obviously, wouldn't be best case scenario.
Mr. Roney, I have a question, and maybe this is just a comment for the board, but I guess if we were to forego the Plan B on the buses, I would really strongly encourage that we go back to looking at those buses that would require us to go into that more seats, more children in each seat, that we look at getting transportation safety assistance back on those particular buses. And maybe that might mean that we have to offer bonuses again for those employees who might, pick up those couple of hours before and after. Maybe there's some money for that. But I, for one, would feel a lot more comfortable if I knew that the buses that we did not have 1 per seat were the first line of defense for students coming on, that they were being checked, temperature checks, and not just the attestation from the family that they don't have a fever or symptoms.
Right, and that's certainly an option. The difference is, for the most part, our overcrowding right now is in the afternoons, and we don't use those bus monitors in the afternoons. But that's certainly an option. We've used them in the morning up until November.
And I know we had some funding issues, and that's one of the reasons that it had to go away. But again, if we are looking at having to do that, like you said, in the morning, obviously, because it's before they get to the school, but I would just really like to, try to look at that as an option.
The other thing, to borrow your phrase, if we're cutting to the chase, Dr. Baldwin, is just that if we are considering going to Plan A, then that means that we're at a point in our COVID levels that we are comfortable letting go of one of the 3 Ws in our schools, knowing that we have the other 2 to protect us. And if we can do that in school, why can't we do it on the bus?
Yeah, and we would still follow the other requirements, obviously a mask. They're going to get hand sanitizer when they get off the bus, but, we certainly would, as the parents do the attestation form before they send them to the bus stop, we would certainly want them to provide hand sanitizer as well.
And couldn't we have a bottle of hand sanitizer on each bus where they just get a squirt as they walk in?
We can't have a hand sanitizer station. You can allow kids to bring their own hand sanitizer on the bus, but you can't just have it floating around unless you have a person that is their job, because you can't put anything on a school bus that is not certified by the maker of that school bus for crash reasons. It's a safety reason. But that would go back to Ms. Churchill's thought of the bus monitor. And again, that was early in the mornings, that was one of their responsibilities, was to hand out that hand sanitizer.
Any other questions?
Mr. Roney, how many was it at the elementary level buses, or schools, excuse me? Was it 16 that you said that would have a based upon your numbers that you know, would have a problem? Was that the correct number, 16 schools?
Yes, sir.
And were most of those, or some of those, or was it evenly divided? I like the example you gave, because as we heard from Ms. Saunders, all of the things we do are additive, but I like the example you gave of 20, 30. So 30, you're still going to have some kids with 30 on a bus that are in individual seats. You will have some that are doubled up. My question is, of those 16, are those numbers, as you would look at them, doable? Or are they so bad and so, not bad, but are there so many that it's actually impossible from where you sit to figure out a way to, I think, Amanda, you used the term, to not let this be a barrier for us at whatever level bringing kids back to school might look like?
I think, and obviously it doesn't impact every single bus at every single one of those 16 schools that I mentioned. But, you know, keep in mind that some of those buses are already on A day running double routes. And then on B day, they're running full double routes. So if you put that together, one per seat, you're looking at 4 full routes. And so now again, that's not every single bus, but 4 full, 1 per seat afternoon routes, that's going to get really late getting kids home. Not as big a deal in the morning because our ridership is not, it's probably 50% of what the afternoon looks like. But yeah, there would be cases in, and I don't have that number, but there would be situations where we are running, a lot of situations where we're running 3 afternoon loads and some where we're running 4 afternoon loads.
Are you saying you would be running 3 or 4 if we only kept it at 1 per seat?
Yes.
So what if we allowed 2 per seat?
If we allow 2 per seat, I think we're in really good shape. I mean, we can absolutely make that work.
In 2 loads or less?
Correct. Yeah, there will still be cases where we're doing 2 runs, but I think 2 per seat allows us to alleviate our issues.
Dr. Baldwin, it may not be a question you can answer because don't know if it's been looked at, but do we have the ability? I mean, for me, all of the things we do, whether it's in the classroom or on the bus, cafeterias, whatever, the additive things are what help us. And do we have the ability, if the board wanted to, financially, to do something, whether it looks the same as it did first semester or it looks differently to perhaps help some way in the afternoon if needed, to do those transportation assistance with our buses in some fashion, or is that something that we can't consider? Or do you know?
Well,
Say to that, you know, we'd have to look at and include Ms. Frisbee in on that as far as the financial part of it, because I know that was brought up. I would also add to that the staffing component of that, because remember, we'd be moving to Plan A for at least some portion of our grade levels. I think we'd have to take a hard look at the staffing too. Not to say it's not possible, but I think it's just as much a staffing as it is looking at the financial piece.
Well, to piggyback though on what David was saying, I feel like what I heard you say is in the mornings our ridership is about half. So in the mornings, how many buses total do you feel like there would be more than 2 people per seat?
Are going to need more than 2 people per
Or
seat?
I'm sorry, more than 1 person per seat.
I would say at the elementary level, it'd be about 60% of our buses. So we're looking at, 100 buses.
Okay. And that's because they just make 1 run in the morning? Is that, that's because they only make 1 run in the morning?
Correct.
Is that correct?
Right.
Okay.
Yeah, because remember, we didn't want those students being there at
No, I get
7
it.
o'clock again,
Absolutely.
so we tried to limit everything to 1 run in the mornings.
I guess short answer to your question, Mr. Bryan, is yes. Whatever this board decides, we're going to make it happen. Now, it is a staffing issue, it is a finance issue, but we'll make it happen some way, somehow, if that's what we need to do for these kids.
Right, and there's always the option, because what we do now is when the student gets off the bus, we do that screening. Well, we could always do it before the kid got on the bus and eliminate the need necessarily for the screening's going to take place as he or she enters the bus, which is an option, and that's an easier staffing issue because that person doesn't have to ride the bus for the next hour and a half.
I think why this discussion is important to be streamed goes back to your point, Ms. Simpkins, and that is we want to make sure our parents understand what's taking place, what safeguards are in place, but also what may be some giving that we have to. That's very important. That gives options for choices on their part. That's why this is very important that we have this kind of discussion and very honest discussion and give you exact numbers to the best of our ability. So, Mr. Roney, we really appreciate you, and we're very fortunate to have you leading our transportation effort, because that's probably up on the stress meter is about as high as you go for Mr. Roney's job right now.
Would you rather do buses or coach basketball game?
Which is tougher? You're down 3 with 30 seconds.
From that answer, so say again.
I said, which is tougher, this or you're down 3 with 30 seconds and you don't have the ball?
Yeah, it depends.
Ms. Swanger?
Yes, Madam Chair. Just a quick update about our calendar and where we are. You know all of the plans that we've been under and how we've tracked the calendar. Just a quick reminder, we need to have 185 days or 1,025 hours. And it's been our practice over the last few years to seek over the 1,025 hours. So we are looking to do that again this year. Of course, because of our schedule, we had early dismissals for a period of time while under those specific plans. We returned to full school days right before the winter break. That certainly helps, and we've been very conservative in counting our hours. But we are where we were this time last year and previous years. We're about 30 to 40 hours shy of where we like to be. Again, we have a high standard. We want to exceed that 1,025 hours, and because we are back face-to-face, we are attending full days. We have had fewer 2-hour late starts, early dismissals. We will finish the school year comparable to where we were last year. So that's a wonderful thing because, again, we want to exceed the hours. Now, that's stating that as long as March weather is kind to us, we're in good stance right now. Still looking for the last student day to be June 1st. You know, we missed a day last week, so we are doing some shifting. Memorial Day will now be an optional teacher work day, and I would recommend no student asynchronous that day. And we're looking at graduations the weekend of June 4th, and the calendar committee for planning next year's calendar will start up on March 10th. If any of you are interested in attending, I'll certainly welcome your presence. We have lost the winter weather waiver that we've been having the last few years that allowed us to have exams before winter break. Unless there's a calendar shift in the law, and I keep bugging Mr. Campbell to see what he hears, probably the first day of school for next school year will be August 23rd. That's just our target date as of right now. So that's our calendar. Do you have questions?
I have a question just in terms of your statement about March weather. Now that we have gotten so much better at asynchronous and remote learning and so forth, can that help us in terms of the number of hours if we have asynchronous days or remote learning days or whatever during winter weather?
Yes, in December, we did have 2 optional teacher work days / remote days, and those days were asynchronous, and students did get credit for their time, so absolutely. Other questions?
Thank you, Ms. Swanger. At this time, we're going to take a 5-minute break. And then we will come back right and ready for Mr. Campbell. Okay. Okay.
Welcome back. I'm going to call us back into session. Our chair, Ann Franklin, had to step away for an appointment, so I'm going to carry us through the rest of the meeting. And so I will start by just handing it back over to Dr. Baldwin.
Thank you, Ms. McMahon. I've asked Mr. Campbell to come to this work session and speak with the board about a very important piece of legislation that Senate Bill 37. It was ratified by the General Assembly. It is now in the hands of the governor, and it has some very significant implications to our operation of schools for the remainder of the school year. So with that, Mr. Campbell, thank you for being here, and turn it over to you.
Happy to do so. Thank you. Madam Vice Chair, Dr. Baldwin, and members of the board, I'm going to address pending bill, Senate Bill 37 for you this afternoon and answer any questions that you might have. If it's okay with you, let me kind of give you an overview of some of the critical elements of Senate Bill 37, and then I'll be happy to answer any questions that any of you might have regarding the interpretation of the bill. First and foremost, Senate Bill 37 is not law yet. All legislation has a 10-day period in which that legislation can either be signed by the governor and it becomes law immediately upon his signature. It can be vetoed by the governor and then it goes into the override process that you're all familiar with. Or the governor can allow the bill to become law without signing it. That is one of the options that's available under North Carolina law to the governor. So right now, the 10-day period for the governor to act or allow it to become law will end on Saturday. So Saturday is the day by which, if the governor is going to veto Senate Bill 37, he has to do it by Saturday. If he does nothing at midnight and we hit midnight on Saturday, it will become law. What does that mean? That then means that by the very express terms of the bill, there is a 15-day waiting period before full implementation. So March 15th would be the day in which Senate Bill 37 would become fully implemented in all public schools. So again, Saturday is the day by which the governor has to act. What could happen between now and Saturday? Obviously, it could be vetoed. And then it would be a matter of whether or not the General Assembly had the votes to override the veto. The other option, of course, is he could sign it. He could sign it today, he could sign it tomorrow, he could sign it Saturday. But if he does nothing, then it would become law on Saturday. One of the things that the executive branch could do is revise the toolkit. They could revise the toolkit in a way that would make it more like Senate Bill 37 or closer to Senate Bill 37. If the governor did that, then there's a chance that it would survive a veto. But I don't know and have no idea, and I don't know anyone other than the governor's close circle knows what he'll do with Senate Bill 37 at this point. Earlier in the week, he said he wanted to have additional conversation with some of the leaders of the General Assembly before he made a final decision with what he wanted to do with the bill. So stay tuned as far as the enactment. From this point forward, I'm going to speak to what happens if it becomes law. Let's assume that Senate Bill 37 becomes law. A couple of big takeaways. First of all, it is a bill designed to bring to an end remote-only education district-wide in any school district in North Carolina. So that's the first goal of Senate Bill 37. There's a handful of districts that have been remote-only since the beginning of the school year. That would not be an option anymore for those school districts. So that is the first goal of Senate Bill 37, is to take away remote only as a district-wide option for all schools. Second takeaway is EC and 504 students. It requires minimal social distancing for those students, which basically means those students would come back to school 4 to 5 days a week, and I'll address the 4 or 5 days in just a few minutes. But it means that those students, K-12, would be offered as much remote education as possible, or excuse me, as much in-person education as possible under the minimal social distancing requirements. I think it's important to remember that the toolkit, and you've got to read all of this together, Senate Bill 37, the toolkit, minimal social distancing, or Plan A, speaks to the distancing. That's what it speaks to. It doesn't speak to a certain number of days per week or other things. Plan B requires 6 feet. Because you have to have 6 feet, most districts went to an A day, B day, A week, B week arrangement simply because physically that's the only way that the school district could maintain 6 feet between students. So I think there's a lot of confusion. Plan A and Plan B don't speak to the number of days per week. They speak to social distancing or minimal social distancing requirements. Those requirements are what led to A day, B day, A week, B week requirements. So those EC and 504 students are required to have that maximum amount of education based on the minimal social distancing. It then moves to K-12 students. And the big takeaway with K-12 students is Senate Bill 37 is designed to give every school board in North Carolina ultimate discretion in all school environments. That's the term that's used in the bill, to decide the social distancing that you will implement. It is complete discretion, in my opinion, in the school board. So you could choose to have all of your schools in a Plan B, social distancing, and all of your busing in a Plan B, social distancing. You could also choose to have your entire school district in Plan A and your busing in Plan A. In my opinion, you could also put a high school into Plan B and bus that high school in Plan A. Total and complete discretion in the school board. You decide the amount of social distancing, and then you apply the safety protocols that go along with that decision. So the busing issues that you just heard, that's going to be a serious game changer for school systems, because it now puts it on you to decide the appropriate amount of social distancing that you want in those environments. So I think everybody can understand that is a significant change from everything you've heard so far today, and it puts that onus on you to make that decision. I will leave it to your good discretion of how to fit that into your discussions today and the advice of your superintendent, but I think one of the great things is you have a school board meeting next week. So as your attorney, I will always encourage you not to get too far ahead of yourself when it comes to decision making. The governor may still veto. He has said he did not know what he wanted to do. So certainly I think I'm happy to answer questions, and you need to have a healthy debate today. But I will caution you about going too far down the road of what you're going to do with busing if Senate Bill 37 becomes law as far as final decisions, because we don't know. We still have a couple of days left before the governor makes a decision, but certainly this is something you need to be considering today in your deliberations. Employees, what does Senate Bill 37 do with employees? Legally, it does nothing. You're in complete compliance now with Senate Bill 37 with the way you have been handling your employees. It creates criteria by which a certain group of employees can request consideration. That's not a legal requirement. Senate Bill 37 is not more restrictive than the Americans with Disabilities Act. Senate Bill 37 does not provide new leave that employees didn't have before. Senate Bill 37 does not mandate teleworking for any employee. What Senate Bill 37 does is require you to come up with a plan to take your at-risk employees and those that have vulnerable children at home to request special consideration. And you are to implement that special consideration and special precautions to the degree you can, including teleworking if you can. You're already doing that. Your HR department under your leadership has had a wonderful plan from the beginning. You've gone above and beyond the legal requirements of state leave and federal leave. You've gone beyond the legal requirements of the ADA in working with employees and trying to make sure that they're accommodated for. And I also know from conversations with your administration, your principals have done a fabulous job of reaching out to employees and taking the time it takes to talk them through it, to talk them through their personal situations, their family situations, help them understand what's available, what's not available, and work with each and every employee. And I'm not privy to precise numbers, and I don't think it's necessary for the work session. You may want to ask Dr. Baldwin later if you're curious, but I think the number of employees that actually need leave right now has been substantially reduced and is very manageable for the decisions you're going to make. There is no concern that you would have enough employees to teach students if you go to an in-person environment, is my understanding. right now. So you're in compliance with the employee sections of 37. There may be something that Ms. Fisher needs to do to reach out to a certain group of employees to ask them if they want special consideration. That's easily done. It kind of fits within the framework of what you've already been doing. So no concerns really about the employee part of Bill 37. It more focuses on the students at that point. It also allows parents to continue to choose remote education. I think everyone knows that, so that will stay in place as far as parent choice. It also says that the school board can make day-to-day decisions on moving a classroom to remote only or a school environment to remote only due to insufficient personnel or, quote, required student quarantines, and that those decisions have to be reported to NCDPI within 72 hours. All legislation has to be read in good faith in a way that it can be implemented. Certainly when you're talking about day-to-day situations, your superintendent has already been given that authority. He's already been doing that. His administration is very fluent in quarantines and works closely with your health department. They're monitoring staff availability at schools on a daily basis and whether or not you have enough staffs to properly supervise a student group at a particular school. So my advice would be just for you to continue to delegate that to your superintendent. Obviously, we don't need to have an emergency school board meeting every time there's an outbreak in a classroom and the health director feels like that particular classroom needs to quarantine, or the superintendent determines on a Sunday night that a particular school is not going to have enough employees. It would not be feasible or workable to call the Board of Education together every time that happens. So it's our legal opinion that you can certainly continue to delegate that to your superintendent. The bill speaks to three components of what in-person instruction is. The bill says in-person instruction means, first of all, it's offered by a teacher of record on the school campus or through enrollment in North Carolina Virtual Public School or other e-learning course offering or use of pre-recorded learning materials, integrated instruction that occurs on the local school administrative campus. This bill is very flexible. In other words, it counts to have students watching a pre-recorded lesson and be supervised by someone. Now, Dr. Swanger will jump up and say, that's not the kind of education we want in the Buncombe County schools, but I am telling you that this legislation recognizes that bringing that many students back into the school environment with all the other issues going on in a given day, in a given classroom, you might not actually have a teacher that can be in that classroom on that given day. The legislature understands the pressure on substitutes and other things, so I think it's important for parents to understand when their children come back in a given day, your child may be watching a pre-recorded message or a pre-recorded lesson rather with a staff member supervising that class, but it might not be their teacher, might not be that teacher of record, because there's a lot of moving parts that go into supervising children and providing an education in a given day. You're also required to provide a meal to those students, so meal service is part of the bill, as is transportation, and we've talked about transportation as well. The 4 days versus 5 days. Again, the bill doesn't speak to that. The legislature chose not to get into the minutia about how you are going to provide the maximum amount of in-person instruction for your students. As I said earlier, you could still opt for a Plan B district-wide if you wanted to. It is my opinion that this bill clearly continues to give you the flexibility to decide whether or not you still need a remote day, whether you need a remote day to clean the building, whether you need a remote day for one-on-one services with students, or because of staffing needs and instructional needs and other things. So I do not believe that it is a violation of this bill to continue to have a remote day, be it on a Wednesday or a Friday like many school boards have been doing. I will tell you that the discussion that I've heard from a lot of boards is walk, then run. I've heard a lot of systems talking about, okay, well, if we're going to go to a Plan A environment for a wider group of students, K-5 and potentially 6-12, then we will stick with our remote day for the first 2 weeks, the first 4 weeks, and let's see how it goes, with the idea that we would like to go 5 days a week as soon as we can. So that is something that I think is up to your discretion, the way the legislation has been crafted. And of course, I would defer to your superintendent on any recommendation about whether you should be looking at 4 days or 5 days of in-person instruction if Senate Bill 37 does in fact pass under that rubric. So that's something too that I think you have the ability to think about and work through. The last point that I want to make, and then I'm happy to answer any questions, I think we've got plenty of time for a discussion, is with the busing and the bus attestation. All the bus attestation is a pass onto the school bus. It's when a parent says, we agree to screen our own child at home and take our own child's temperature before we put our own child on that school bus. It does not alleviate the requirement that's in the toolkit right now that every single one of those students still goes through a temperature check and a screening before they can enter the school building. So parents need to understand that you need to check your own child every morning to avoid the unpleasant situation that your child gets to school and has a fever, that your child gets to school and cannot pass the screening. That child will have to be isolated. It's not a violation of law. It will be very humanely done, but it will not be pleasant for the child. It will not be pleasant for the parent if the child now has to be isolated until a parent can leave work to come to school to get the child. I cannot emphasize enough how important it is for parents to take their children's temperature and to screen their own children every morning, because if you send a sick child to school, you're going to be called at work as a parent and told to come pick up your child, and your child will be isolated until they can get there. The question has come up, well, why doesn't the school bus just wait, or can't the parent come get the child then? No, that is completely unworkable. A school bus legally cannot sit on the side of the road for 30 minutes waiting on one parent to come get one child. So I think I've said enough there, but one last time, parents, please screen and take temperature checks of your own child every day before you put them on a school bus to avoid that unpleasant eventuality. I'm happy to answer any questions you've got about the bill or anything else that I can.
I have a question about Section 2(1)A.
Okay.
So if this were to be passed as is, what you're saying is, even though it says all students who have an IEP have to have in-person instruction under Plan A, you're saying that still could be 4 days a week is the way that you're interpreting that?
Yes, that is currently our interpretation. Now, again, we would strongly encourage the board to move to a 5-day per week as soon as possible. But if there were legitimate reasons that the 4 days needed to be in place, then I certainly think that could be done. And let me give you a simple example. You have a lot of children that have IEPs that have very minimal needs. You have some children that only need, and I'll just use an example, and this is not a qualitative statement, it's a quantitative statement. They may only need 30 minutes 2 times a week of some kind of direct instruction. That's literally all their IEP calls for. Well, if that student doesn't come to school on Wednesday, that is not going to be a violation of that child's right to a free and appropriate public education under federal law, because the child is getting regular education and all the special education that their IEP calls for easily over 4 days. Some children, though, Ms. Simpkins, have very intense needs under their IEPs, and they need specialized or direct services 5 days a week. Right. Your administration is fine to say, well, that child, even if we have a Wednesday remote day, that child will still come to school on Wednesday. And I think they've already been doing some of that to meet those federal requirements. So the act, I think, was very good in leaving those kinds of decisions with the IEP team, because that's the hallmark of the Individuals with Disabilities Education Act, is that each IEP team is supposed to decide what's best for that student. So even if you were 4 days a week, some IEP or 504 students would probably still be given the option of coming physically on that Wednesday or that 5th day to meet their requirements under their plan. Good question.
Any other questions for Mr. Campbell?
I do have a question, Madam Vice Chair.
Talk about summer school, summer camp.
Chris, in looking at the Senate bill, the ratified bill that we had copy of, under Section 2, number
number is
1,
the one that
it says
addresses
local school administrative units shall
This
comply with all
only
requirements of the
addresses the
Strong
end of
Schools North
academic
Carolina Public
calendar
Health
for this
Toolkit,
For this
K
year.
through
So it's
12.
shortened duration through
And
1st of June, whenever
That's
each
correct.
school system is
So
ending.
the last student day on your calendar. That's correct.
I'm sorry, did you hear the beginning of my question?
I did not. Mr. Queen, if you'll repeat it, please.
Oh, I apologize. Under Section 2 of the Senate Bill 97, or 37 rather, it states that local school administrative units shall comply with all requirements of the Strong Schools North Carolina Public Health Toolkit. And I know when this was drafted, it was back in probably February, March timeframe of last year, when there was much unknown about the situation with COVID. And I think that there was, an attitude that we needed to do all we could and implement all the steps we could to protect both our children and staff. And now, a year later, we have, both in the medical community and even in the community at large, learned quite a bit of information. I preface saying all that just simply to say, it seems that the legislature is wanting to pass the decision of doing anything contrary to the toolkit down to the individual LEA. And my question is, has there been any appeal either from the legislature, the governor's office, or even the health department to revisit that toolkit and make adjustments, if appropriate, in certain areas? Because I go back to what Ms. Simpkins said early on during this afternoon's meeting, and I don't know I get it exactly right, but in essence, she said we're sort of being constrained or handcuffed by the transportation issue in trying to get our schools reopened, and its application to the can't commingle a 5th grade student with a 6th grade or higher. And that's creating a huge amount of problems with our transportation plan. And it seems like we need to be looking at those things because, it seems, I'm just sort of hard pressed, give me a little heartburn to say that we're going to do it a different way. We're going to not necessarily follow the exact guideline of the Strong Schools Act in busing. I think that would, that just doesn't sit well with me. But it seems like that they need to revisit some of these issues and get them updated if appropriate. Is there any action going on at the state level to do that?
Mr. Queen, I'm not familiar with any action right now to try to take the toolkit and harmonize it with Senate Bill 37. Again, before Senate Bill 37 becomes law, the governor has the ability to work with DHHS to revise the toolkit and then veto. If that doesn't happen, if this just becomes law on Saturday, then in my opinion, the executive branch will have to revise the toolkit because it will no longer be law. Senate Bill 37 will trump the toolkit, will take precedent over the toolkit, and at that point, the executive branch will have to revise the toolkit to make it fit Senate Bill 37 as far as recommendations. So I think that is probably, at this point in time, I think that is probably more likely.
And just to clarify, I think I heard from you, Mr. Queen, that it had not been revised at all since it was initially launched, but that actually is not the case. As I understand it, DHHS at the state level has revised the toolkit at least once and maybe twice since it was first issued. Is that correct?
Yes, it was revised in December and then again in February.
February 2nd.
I think Mr. Queen's point, he can speak for himself, but I think his point was the health restrictions have not significantly changed in the toolkit, and I think that is a fair statement.
Any other questions for Mr. Campbell? Thank you very much, Mr. Campbell. And so at this point, we're going to go ahead and adjourn, I believe, to reconvene later for our special called meeting. Is there a motion to adjourn, please?
So moved.
In a second? Second. All right, I'm going to do the roll call. Pat Bryant?
Aye.
Amy Churchill?
Aye.
Amanda Simpkins?
Aye.
Max Queen?
Aye.
Peggy Buchanan? Aye. And Cindy McMahon is aye. So that is unanimous, and we will adjourn. Thank you.